Erythropoietin is a glycoprotein hormone whose function is to stimulate the production of red blood cells as well as preventing cell death. The process of erythropoiesis allows red blood cells to be regenerated. This naturally occurring hormone is produced in the kidneys and sometimes in the liver. The production of this hormone is regulated by a feedback mechanism focusing on the oxygenation level of the blood. When oxygen levels are high, EPO's transcription factors are destroyed because the body only wants to keep the amount of red blood cells it needs. This helps maintain the blood's low viscosity. On the other hand, when oxygen levels are low, then the production of EPO is stimulated. Nowadays, the main use for EPO is to treat anemic patients who suffer from a low amount of red blood cells. This hormone can also be used to treat renal failure, HIV, and many other medical problems. Also, many patients are administered EPO pre- and post-surgery to avoid needing a blood transfusion.
Red blood cells are critical in the transportation of oxygen to various organs and muscles throughout the body. Endurance athletes especially count on red blood cells to deliver O2 to their muscles in order to maintain their stamina. When muscles are deprived of O2, the anaerobic systems kick in, releasing a byproduct of lactic acid which causes fatigue. In the past, endurance athletes would resort to a certain type of blood doping which consisted of removing blood from the body 2 weeks prior to competition and allowing EPO to replenish the lost red blood cells. Then they would put the blood they had taken out back into their bodies. This quickly increases their red blood cells as well as their stamina. Starting in the 1980s, athletes started injecting themselves with EPOs to increase their red blood cell count. Although their performance was enhanced, it was a very risky path. The increased amount of red blood cells in the bloodstream heightens the viscosity of the blood to an unhealthy level. This can cause thrombosis, stroke, or a heart attack. Fevers, nausea, seizures, and many other symptoms have been noted as well. In the 1980s, a synthetic form of EPO was tested and the trial was a success. Many patients who previously relied on blood transfusions greatly benefited from this breakthrough. Over the years, researchers have discovered slight differences in this hormone in various animals. Occasionally, when human recombinant and EPO is injected into a dog or a cat, antibodies are produced which destroy the synthetic EPO as well as the animal's naturally produced EPO.
This leads to another problem facing engineers today. Since only mammalian cells have the capability to produce EPO, the supplies are limited, which increases costs. Researchers are trying to discover a way to produce this hormone in plants, such as tobacco, without interfering with their natural hormone production.